when it comes to sitting, you want to make sure that your monitor is at least at eye level, maybe a little bit higher, not lower. You don't want to be looking down to your screen. You don't want to be having your head down for long extended periods of time. You need to be looking straight ahead or a little bit up. But also when you're driving, I guess, people driving vans and trucks got to be very aware of this, and now the four-wheel drives as well, looking down a lot more than what people do in cars. Not saying that you shouldn't be driving these things, but you need to just be aware of your posture. You need to be looking up as often as you can when it's obviously safe, but just anytime you stop at a traffic light, good idea just to look up, stretch your neck. Don't wait for pain to come. Don't be in pain before you do something about it. Pain is a warning sign that is delayed. Pain only arrives to a person when they've got around 40% damage to a nerve. So for example, if they've got 100% function of their neck muscles are working fine, there's no problems, there's no scar tissue, no knots, no restriction to the blood flow, then that person has got 100% function of that area. But once they start getting some scar tissue, some knots, and if 20% of that muscle is damaged, they most likely will not feel any symptoms still. So that is very important to know. So don't wait for symptoms, don't wait for problems to come before you start doing something about your health. In fact, you need to get your spine adjusted. Some people every month, some people every week, some people every 3 months, and it all depends on your situation, your body type, the amount of damage you've got, the amount of strenuous activity that you do, and the amount of time you have in a poor posture, in a poor position. It's very important that you do take care of yourself and fix your problems before they actually become symptomatic. Okay. And when it comes to correcting yourself, we can't tell you everything you need to do. Nobody can be with you all day. Everybody's got different habits, so we can't tell you everything you need to change. We just can tell you the correct posture, and you need to apply that to all things that you're doing. So maybe an example of this, a couple of days ago I saw a person who I had told about posture and the effects of posture, and he came back and told me how he realized that his car seat was too high. He was actually putting his head down and a bit forward to avoid his head hitting the ceiling. He's since corrected that, and I wouldn't have known that his seat was high. I can't, know what everybody's situation is. You need to know correct posture and then work on it in your own way. And with our help, we'll be supplying some information to you that you can use immediately to resolve your situation, those of your family, to prevent any serious problems. When I say serious problems, it's been shown that a forward head carriage, so your head moving too far forward, that posture puts so much pressure on your nervous system that it actually has been shown to take up to 15 years off your life. So be serious about your posture. It's very important. I will give you the postural exercises that need to be done. They'll be in the link below the video. Just have a good look at those. The third thing we need to be aware of to correct postural syndrome is actually correcting our spine. Spinal correction is something that can be done at home and in the office. It's a little bit different to just sitting up straight and correcting your posture. Spinal correction is twofold. You can have one bone that's misaligned, which is called a subluxation. That bone that's misaligned can be touching a nerve, affecting the organs and muscles that it controls. Those bones can be pushed in place they're a simple adjustment process that chiropractors do. But spinal correction in general is relates also to having an incorrect shape in your spine. So when you look at somebody from the side, they should have 3 curves, as you can see in the image here. Those curves need to be maintained to give your spine the best chance it has at fighting gravity and fighting the work that you do and fighting, poor habits. Having your spine correctly aligned is the number one way to guarantee that your nerves are working properly and that your body's functioning properly. At the end of the day, you want health. Health should be your number one asset. And you may just have neck pain now, but there's so many more things that the nervous system controls than just neck pain. So you want health to be your number one focus. When we say health is not just the way you look and the way you feel, because you can have heart disease and not know it, you can have cancer and not know it. Health is 100% function, optimal function of your nervous system. So that will be the physical, emotional, spiritual health as well. When everything is working in harmony, that is health. But when it comes to the physical and emotional health, we can help by correcting your spine. It may sound like a big thing, but a big promise, but it's not a theory. When your spine is in the correct position, there is more space for your nerves to flow 100% of the time, not just sometimes, and not 80% of the time, and not maybe, all the time. Okay, so you want to make sure that your spine is in correct alignment. We have a lot of tools and a lot of equipment that we use in the office to correct people's spine based on what it should look like after seeing an x-ray of their spine. So we take an x-ray of your spine, we measure the angles, we compare it to normal, and then we do what we need to do to correct your spine, and then we give you the exercises that you need to do at home. Okay, a lot of information has been given in this video, but it will be a lot clearer once you look at the website and watch this video a couple of times, because being so long, you will not learn everything in one sitting. So watch it a couple of times, and I urge you to go to the website and learn what you can to not only correct your neck pain, but to actually improve your health and possibly add 15 years to your life. Okay, thank you.